Caroline Rogo is an interior designer who has a passion for her work and life. In 2006, she had a very small lump in her belly button. When she asked to have it biopsied, her GP thought she was being overly cautious.
Because it was tiny. Lo and behold, it came to be that it was ovarian cancer. It had metastasized, traveled.
In 2012, approximately 22,000 American women will be diagnosed with ovarian cancer. Over 15,000 women will die from it.
Ovarian cancer has a high mortality rate because it's almost always caught in late stages. In fact, 80% of the time when a woman is diagnosed with ovarian cancer, it will be at stage 3 or 4, which is a much more difficult situation to manage.
And of course, it was ovarian cancer late stage. I had surgery, a total hysterectomy to remove all the tumors. And then once I was healthy enough or strong enough, I had chemotherapy for 6 months.
Early detection is crucial because we can catch the disease at a point where we can cure it without the extensive surgery and chemotherapy that may be required with a late detection.
But identifying the disease at an earlier stage can be challenging. Symptoms of ovarian cancer are subtle, and there is no early detection test.
I was bloated, but I'd been bloated and constipated my whole life. It was just part of me. So there were no symptoms that I recognized. So it came as a great shock when I was diagnosed.
Most women with ovarian cancer do have symptoms, but they're vague symptoms. And the symptoms that we specifically hear from women are abdominal bloating, change in bowel habits, maybe a little pelvic pressure, very vague symptoms that all of us experience at some point in our lifetime.
One issue that persisted for Caroline was a feeling that was very similar to the symptoms of a urinary tract infection.
I went to the GP for urinary tract infections. It always came back negative, which I was very happy to hear. Looking back, the mistake I made was not pursuing that. Okay, why does it keep coming back negative when I keep having these infections?
The tricky part is to know when to pursue the diagnosis. And the best advice is that if you have these symptoms and you try traditional methods, change your diet, increase fiber, increase exercise, and the symptoms don't go away, then women really need to pursue the possibility that this might be something more. And they need to be advocates for their own care, particularly with physicians who may not be as familiar with this diagnosis.
Don't ignore something that persists. Don't wait for that right answer. If it's something that you're feeling and you know you're not comfortable, pursue it.
Awareness about ovarian cancer is especially important for women at high risk.
Risk factors that I would be worried about: multiple family members with breast or ovary cancer, premenopausal breast cancer in the family, premenopausal breast cancer in the patient herself, and in particular the Ashkenazi Jewish population with breast and ovarian cancer. I think it's very important for women in the high-risk groups to understand that they are in high-risk groups, that there is the option for genetic testing, that there are ways to decrease their risk, and that there is the option for prophylactic surgery for those women.
For Caroline, raising awareness is key.
Just spreading the word makes me feel very good about having what I have. If I can help get the word out there, hey, there is help, be aware, learn what the symptoms are, be empowered, go out there and take care of yourself and others.
For more information, visit the National Ovarian Cancer Coalition at www.ovarian.org or by calling 888-OVARIAN.